everyone. My name is Terrell Friday.
And my name is Tyler Brown.
And we are Future DDS. Today, we are here with a few people from Promethean Dental Systems, Donna, Rick, Mike, and Jerry. We had the pleasure of meeting them recently, and we just wanted to, of course, allow them to speak a little bit more about what PDS is and how they're making an impact within dentistry. So if you guys could all just reintroduce yourselves and kind of tell a little bit more about what your position or what your main role or focus is within PDS, we can get started.
Okay. Hey guys, it's good to see you again. I'm Dr. Jerry Cooper. My background is I was in private practice for 30 years. Went back and taught as a faculty member in the comprehensive care clinics for 14 years. And I focus in PDS mostly on the clinical side and the education piece.
Gotcha. Okay. Awesome.
Hey everyone, my name is Donna Armstrong and I focus on center operations and marketing for PDS.
Yes, I'm Rick Callen, and as with Jerry Cooper, I had a private practice for 17 years and was in education for 20. In Promethean, my main concern is with educational development, innovation, and technology.
Hi, my name is Mike Hill. I am with Promethean. I've mainly focus on the financial aspects of the firm, and I have an education background as well as a faculty member, so I help with some of that as well, but not anything clinical.
Awesome. So yeah, we had the pleasure of meeting this amazing group of people over the weekend, and we learned what they were doing. We had to bring them on and really ask them to give us an explanation of what it is that they have going on. So if you all could, just kind of start off the video. What is PDS? What is Promethean Dental Systems?
So Promethean Dental Systems is a technology and innovation company that provides dental education through a dentist's full life cycle, from being a pre-dental student in undergrad to dental school student, licensure exams, as well as continuing ed and remediation for practicing dentists. And we also offer a course for international students seeking acceptance into U.S. dental schools.
Awesome. So, we've learned a lot about PDS in the past, weeks. But, if anyone else out there maybe hasn't heard of it, what kind of sparked the idea behind it? It seems very novel, especially in, an industry of dentistry where technology is definitely at the forefront. But this is a new technology that we haven't seen before. So what kind of sparked this idea?
Would that be mine, I guess? Good morning, guys. Good to see you again, and thanks for this opportunity. As you know, we discussed this a little bit before when we had you in our presence, and basically what sparked the idea was the need for improvement of dental education and enabling the student to perform better when they got into education. But as we developed this idea, it was clear that we could expand this to the entire life cycle of dentistry. And that was pretty much, from pre-dental through dental education, including with board examinations, remediation, and recertification at some point in time. So it has evolved as we have developed. But the good part is that, I think it's just beginning, and we're very excited. And I think you saw some of that excitement when you visited with us. We're very excited about the potential where this is and where it can go, and how much good we can do with it.
And so, while we were with you all, the main piece of technology that we were able to use was doing work on the Semidont. So, that's something that we were extremely excited about. We had a great time using it. Can you guys kind of explain what the Semidont is and basically the tech behind it?
Sure. The Semidont is a key piece of technology that we use, and it is a haptic virtual reality simulator. What that means is that you work in a virtual environment. You have a three-dimensional viewpoint of everything that you're working on. It's very detailed, very specific. And the haptic piece is you have a handpiece, you also have a mirror. And with the handpiece, it really is a lifelike feeling of touch. When you touch something, you feel like it is there. When you work with the Semidont, it is so advanced that even as you are working on different items or different surfaces, they feel differently. almost anybody who has experienced it is just blown away about how it feels. Clinicians, dentists who have used it are just amazed at how realistic it feels. They describe it as feeling like you're actually cutting on a tooth. It is just something that is phenomenal. Now, the technology was developed originally, believe it or not, by a company out of the Netherlands that focused on very high-end flight simulators, things like Department of Defenses would buy and things like that. And somehow or another, they decided that the haptics would be useful in this space with the Simodon. They've developed the Simodon. Ultimately, they wind up selling the product to a Japanese company that's very involved in dental education that everybody's heard of, Nissan. It is a phenomenal piece of technology, and it is one of the core pieces of technology that we use.
Gotcha. Okay, so we were able to get our hand on tests, and like you said, it's very realistic. I guess it's something that I've never known before. I didn't think about it before, but when you put your hands on it, it definitely does have that real feel. How could, I guess, how has it been implemented so that dental students and specifically pre-dents, how they can use it to eventually become better clinicians? They don't necessarily know exactly what it's like now, obviously, if they're not in dental school yet, but how do you guys see it, or how could they become excuse me, better clinicians by using this?
Let me answer that one.
Okay.
I'll try to anyway.
All right, Jerry.
Like Dr. Callan said, pre-dents is kind of where we started with this.
Okay.
And so, we've got more background in that. We've got more data in how that works. But when I think of pre-dents, I think mostly of two groups. The first group would be our international candidates.
Mm-hmm.
And then the second group would be the undergraduates that are applying. Okay. So just hit real quick on the international ones, they could practice their skills on it over and over and over, which is great. They can also use our assessment though to demonstrate to the schools where they're applying that they do have the hand skills, because apparently that's something that schools struggle with the international students, is there's a big variability in what they present when they come. So this would help the schools, and it would also help the candidates to demonstrate they've got that. But the traditional undergraduate student, I mean, that's kind of one of our passions, really, because we feel like that. We've had a lot of undergraduates come and work on the machine, work on the Simodon, and most of them love it. I think you guys, it's like a video game. You just want to sit there and we can't run people off. You just want to keep doing it.
Yep.
But there's a few applicants that when they sit down at that, after about 30 minutes, they go, I hate this.
Mm-hmm.
I could not spend my life doing this. And they, that's great for them to find out before they spend all these thousands of dollars in school and they're unhappy, in their career choice. So I think that's great for them. One of the negatives we hear about the undergraduates is they're afraid that the admissions committee is going to use this to weed them out. But we look at it totally opposite. Like I was on the admissions committee for years, and you have these applicants, you look at them and you just love them. For some reason, they just really stick out. But let's say they demonstrate their hand skills are not great. So we already know that with practice, you're going to get better. So instead of waiting until you get to school and try to develop your hand skills, do that ahead of time.
Mm-hmm.
And so when you enter school, you're caught up with everybody. You're good to go. You're not spending hours in the lab trying to catch up and your academics get behind, which is what we've seen happen quite a bit. So it's not a way to weed people out. It's to make everybody better. If you're already good, this is one of Dr. Callan's best statements. He said, if you're good to start with and you practice on this before you get to school, think how much better you're going to be when you leave school.
Yeah.
I mean, it's great. It's almost a no-brainer. Why wouldn't you want to get better before you got there? Right. I mean, and don't forget, you get to use the mirror. Right. And the Simodon is without doubt, I think, the best mirror trainer anywhere.
Indirect,
I just think that that's the way to go. So anyway, I hope I answered your question.
No, you did. And I kind of want to go a little bit more in depth about the admissions aspect of it.
Okay.
You saying that, you have worked with admissions for a while. Can you kind of touch on that a little bit more on how admissions could kind of use this system in order to, you know, not necessarily predict the competence of somebody coming in, but how can admissions use this as a tool in order to decide on who would be the best fit for dental school?
Well, the way I see it is let's just say that in an ideal world, everybody took the assessment when they applied. Okay. So all the admissions committees are looking at it, but just assume that. So when you look, yeah, you can rank them, but that just shows where you are today. It doesn't show can I learn. It doesn't. So, you can't, everybody learns.
Right.
Everybody improves. Some never improve enough. So you need to know if somebody can improve.
Gotcha.
So if I was on the admissions committee, as long as I could see they started here, but they got better.
Yeah.
Right.
That's all I need to know. As long as they're showing progress and not plateauing.
Okay.
Gotcha.
That's one way to do it. And then, like I say, if I saw somebody that, at the interview, they were just, oh yeah, we got to have this student, this is the one we got to have, and their hand skills are not real good. Say, why don't you go practice, get better, and do that so that we know when you get here, you're not going to get behind.
Right. Definitely. Okay. So, and I guess traditionally in the past, we've always had other things that admissions have used, maybe a portfolio of art, maybe it's a hobby that you guys picked up, maybe it's playing an instrument, different things of that nature. And traditionally, in schools, we've been using mannequins, and for IS students trying to get admission. So I guess, what is the bigger advantage? What differentiates, PDS and this Semidont system from a mannequin or traditional, I guess, test of hand skills or a way to improve?
I think, part of that, and don't fall asleep here. I know this is dangerous territory. Talk about learning theory and learning technical skills as opposed to didactic knowledge. There's a huge science behind that, and that's been developed, particularly more recently, about how that develops over time. And it's an idea of practicing, and what Dr. Cooper or Jerry didn't expound upon is the initial aspect of this, as you experienced with your initial try, had nothing to do with teeth. It had to do with the blocks that we're working on, similar to what you might start off at dental school. Yep. But what we know is over time, you can improve, and we can quantify that improvement. And that's one of the huge things about this. We have 6 tenets in our, 6 differentiators, and ethics is one of them. Ergonomics is one of them. As you, Terrell, I know we talked about that a few times.
Hey, we're getting better, man. We're working.
There you go. It'll help you, I promise. Objectivity. Well, this is a very objective assessment. This isn't something where someone's looking at and 5 people are judging, you get 3 different opinions. What we have here is an objective assessment that will quantify not only someone's starting point, but also their ability to improve. So this is something that can be done, fairly quickly over a period of time, and it is very objective. And we can say, all right, across the board, this is where this person stands. And guess what? Across the board, this is how someone has improved. Mm-hmm. And it also tells a person, I need to improve more and do this prior to entry to dental school. As you well know, there's no time in dental school to catch up. Yeah. There's no time in dental. It's just, so let's take the stress out of that. Make sure you come in there and talk to me about confidence. How much confidence, matters in your dental career, in your dental school career. And if you can come in confident and able and just master these things early, that is where I think the differentiation comes and the excitement comes, because as Cooper said again, just think of where you can be if you start at a higher level. This is, as I keep repeating, it's not my saying, but it's a tide that rises all boats. Mm-hmm. And those that are struggling get better, and those that are good get better. And it's just an overall improvement. And it's just exciting to me, the potential that we can see with students. And again, they enjoy it more when they're performing better, obviously. Yep. And that's what we like to see. And that way we can teach more. Mm-hmm. And that's what we're there for.
Awesome. Awesome. And so, speaking of ethics, right? This whole issue with the live patient boards, I remember even, since our first year, we've heard upperclassmen just speak of the horrors of
Searching for
going through
lesions.
the entire boards process. And you all had mentioned how you all believe that using the Simodont on the boards is actually a much better preference or a much better option. So if you all can you kind of go into using the Simodont on the PDS technology for the dental boards, and how does this make more sense for both the patient, most importantly, but also the dental student?
I guess I can follow up on that too, if you like. Part of the board, again, as you said, part of the stress of the board has very little to do with the actual procedure that you have to perform. It's the fairness of it, in the sense of, is this lesion is more challenging than another lesion? Is that patient going to show up? What are the financial aspects of it? I mean, I don't need to tell you all what all we're talking about.
Right.
This is one of those things that again, it proves for other reasons, one of our differentiators to be cost effective. It's making it's less expensive to do it this way for the person taking the board. It has a fairer outcome because the lesions are similar, and the objectivity of the assessment. And again, this patient's always going to show up. They're going to be there on time, and it's going to, the technology is going to be effective for you. It's a good challenge of your skills, which is really what you're trying to accomplish. Does this person actually have the skills? That's what we want to know. And so all across the board, it kind of checks the boxes. Now, we will tell you as clinicians, and yourself, there is nothing as pure and as vital as working on a live patient. There's nothing that's going to replace that. But for all of the reasons mentioned above, this we feel is a superior option.
Got you. Okay. So I guess you spoke on a little bit about the options, being able to do this, but, I guess one big thing as a dental student would be, accessibility to the Simodont. So as of right now, I guess, what are you guys' plans for, allowing access for students, and potential plans for expansion for, availability of the Simodont for pre-dents to try out, for dental students to try out, or maybe even licensure?
Well, that's a question we get a lot.
Okay.
And I promise we are working very hard at it. Right now, our current headquarters is in Athens, Georgia. So all the Georgia schools out there, we're here and available for you. But obviously we want to move out and make this available to everyone.
Right.
But as you know, the Simodont is a machine, and it is not easily portable. So as we put some thought into rolling out the expansion plans, we're in the process. We have to do it kind of slowly. We're in the process of opening our second center in Michigan, and that's going to be with our partner Kilgore International. So we're very, very excited. And one thing about that particular center is not only will it be able to offer all of our standard courses using the Simodont and the mannequins, but also this has a classroom style location where we can do the group learning for the international students. So we're very excited for that. And then as we move forward, we're going to be collaborating with other types of partnerships with the goal of opening several more locations this year.
Awesome. And so throughout this entire interview, you all have given us a lot of different information points. We're closing up now. Do you all have any final points that you would like to bestow upon the audience, just about PDS, about you all's mission, whatever it may be?
Well, I think I'd like to start with that one. Oh, go ahead, Jerry.
I'm sorry, Mike. I just want everybody to know how passionate we are about this.
Oh, sure.
I mean, I hope it shows through. We really
yeah.
care about this. Go ahead, Mike. I'm sorry.
That's all right, Dr. Cooper. Looking at this, it kind of feels to me like the future is here now. I really feel like we are just beginning to explore what use of technology in dental education like this and throughout the dental life cycle can do. Things that were never doable before because of the nature of treatment of patients. the one-on-one, the aspect of you're working in a confined space and a limited space in a mouth. Those type of things are no longer, let's say, necessarily a constraint on what you can do.
Right.
So I actually feel like the future is kind of limitless with this. It's amazing every time we bring a clinician to it who's never been exposed to it before. They have all sorts of different ideas. Where it goes, I can't even begin to tell you where it's going to go because I don't know at this point. All I know is that limitations on what can be done in education and what can be done in training and what can be done in skill development and what can even be done in proof of continuing competency and regaining competency or demonstrating that you're competent. These things were not really doable in the past, or at least not practically doable.
Right.
Now they are. And that to me is what's so exciting about revolutionizing oral health and the care of patients in this country and elsewhere, is that we're able to do this now.
Yeah, that's awesome. Well, I definitely want to commend you guys for all the work that has been done so far. Continue pushing forward and pushing dentistry forward, honestly, and implementing these new technologies and new ways of applying and developing skills going forward. Thank you guys for taking some time out and kind of explaining more about what PDS is, what your goals are, and where you guys plan on being in the future. We hope to see more from you guys, and we're working on some things. So in the future, it's going to be amazing going forward. And again, thank you guys for this. If anyone has any questions for you, I guess, do you guys have a website or email, or how would you guys most like us to get people to reach out to you all?
Yeah, have them go to our website, prometheandentalsystems.com, and just fill out the contact form.
Okay, perfect. So
we'll be in touch.
Yeah, definitely. We'll make sure we put that information down in the description box. So anyone out there, if you have any questions for Donna, Mike, Jerry, Rick, anyone out there, make sure you get in touch with them. Information is down in the description box. Again, if you have any questions for us about our experience on the PDS Semidont, you can obviously go over to Instagram, send us a DM there. We can give you, our feedback and answer any questions you have, or add it down to the comments and start a conversation there. That's going to wrap it up for today's interview. Thank you guys.
Thank you.
Thank you guys. Pleasure meeting you. Look forward to seeing you again.
For sure.
Definitely.
Take care.